There we go. All right, what's up, internet? I've been trying to run this for the last like 10 minutes, but having technical difficulties. Anyway, winding down for the day. I'm done with patients. Sofco's finishing up. Had a really good week this last week or two. Been developing a relationship with one of the local spine surgeons, and looks like he's starting to trust us a lot more. He's been feeding us this last week, so it's been great, which means we've come in contact with a lot of people, and one thing that sparked is the title of the video is "You're Right as a Patient in the Healthcare System." So with these new evals and patients that we've come across this week, one of the biggest topics that's come up is the quality of care that they've received. I think one of the biggest things that people don't realize is that your right as a patient is to go where you see fit. Whether your insurance covers a certain clinic is another story. Those plans are very specific and individual, but legally you have the right to be treated wherever you want to be. It's kind of funny. I don't know if you guys can hear the song in the background, but it kind of fits nicely. What's up, Mario? So your right as a patient is to go where you want. So if you feel like you're in a place, specifically in physical therapy, in a clinic where you don't feel like you're getting treated well, you feel like you're just a number. I met a patient just yesterday and had them come back today. There was a spine case with a neck with radiating radiculopathy pain into both arms. So I wanted to see them the next day because it was nothing emergency, but something that I wanted to see pretty quickly to see how they were progressing. Long story short, they're doing better, but their biggest takeaway was they were impressed in how much attention they received in our clinic. We only see patients one-on-one for the full hour. They had been to some PT clinics in the past where they just felt like a number. They got, they saw the physical therapist for a few minutes and got passed on to somebody else for the rest of the session and got no feedback from the therapist, no contact from the therapist for the remainder of the session. So you're not going to get that here. So that's one of the biggest things that they were impressed with was just the environment. They got to spend the whole session with us, and it was kind of necessary. Given the case, it was, again, the spine case doesn't matter, but something that can change rapidly, which needs constant assessment. So that whole hour we were communicating, and it resulted in them feeling better than they had been in almost years. Honestly, it's been a long case or a long experience for them in terms of their problems. So that communication wouldn't have happened in a clinic that isn't set up to see patients like that. So a lot of clinics out there, they see high volume, that's fine. That's not how we like to do things here. We don't think it's fair. So if you're in a clinic that you feel like you're just a number, you're not getting listened to, you're not getting heard, shop around. Do your research, see if there's anything else in the area that has a different model. You have that right. You deserve better treatment if you don't feel like you're getting the highest quality. So if you're in the North Shore, come see us, Team Sapiens. Again, anywhere in Illinois, if you see this video and you're not within driving distance of our clinic, reach out anyway. I know people all over the place that can help you guys out. There's really good clinicians and good models all over the place in the city, down south. I can help you guys out. Another thing I wanted to bring up, Medicare. If you have Medicare insurance, the only way they pay and reimburse your benefits or reimburse your sessions, your benefits dictate that you have to be seen one-on-one by a physical therapist or a physical therapist assistant. So if your therapist or PTA has eyes or is responsible for someone else's care at the same time that you are there, that has to be billed differently. So ask them, what the situation is. If again, some clinics, clinicians see multiple people an hour. Again, that's fine. But if you're a Medicare patient, that's not allowed and needs to be billed differently than one-on-one care. So again, we do that for everybody here. It doesn't matter if you're Medicare, it doesn't matter if you're Blue Cross, doesn't matter if you're paying cash. Everyone is seen one-on-one for the full hour. So that was a big education point that I wanted to bring up for you guys, because a lot of people don't realize it. So again, if you're not happy where you are, shop around. Everyone's got, a plumber they trust, or an electrician, or physician, dentist, barber, anything. So again, take the same attitude to PT, find somebody good, stick with them. Till next time. See ya.